Hi, my name is Amy McKeechin, and I'm interviewing Pam Ivy today. And she is a clinician here at Gwinnett Medical Center, and she has also been a supervisor. And so I thought she would be a great example of a servant leader. So Pam, I have to ask you to make sure that you're okay with me interviewing you and granting permission for this to be
Yes, I am.
Great. All right, well, we'll get started. So what do you think you can do in your leadership role that to empower others?
Being a clinician, I'm a staff educator and trying to get them to continue their education. A lot of the nurses that we have right now are from 2-year degree schools,
Right.
and trying to encourage them to continue on to get their BSN and further.
Right, and I understand you're in school right now.
Yes, I
yourself.
am.
Great. So you're a great example. So you're leading by example, and that's a good thing. What's your definition of a servant leader?
I had to look that up when you told me we were going to do that. The definition of a servant leader would be someone that is doing their job not for themselves but for the people that they work with. They're not looking at the bottom line, they're looking at what that bottom line does to the people they work with.
Right, and when I thought about who would I interview, because I've worked with you for several years now, I thought, well, that's what you do. You empower the other nurses because you put your life into them, and even when you were a supervisor, you did that. So that was a great job.
Thank you.
I applaud you on that. What would you say your personal leadership strengths are?
I'm organized. I thought about this before I came over, and then everything else happened. Organization. As an educator, I try and make sure that people are doing what they're supposed to be doing, but not by telling them what they're supposed to be doing, educating them on why they should be doing it. What else would be strengths? The fact, like you said, I'm showing them by example, by going to school, that is important, even though it took me 40 years to realize that. I'm still doing it now. So I think that does help. I try and care about what they're doing by showing them, asking them how they're doing, how their family's doing, not just things about work. I try and bring in their personal aspect too. Not that I'm trying to be nosy about their personal, but
Right.
just making sure that everything's okay.
And I think that's very important, that they know that you do care on a personal level, and it's not just, okay, let's get this job done, 1, 2, 3, and make sure, that the patients are taken care of. But by doing that, then maybe they'll create that relationship with their patients also, and it's not just seen as the next patient.
And I think another thing is that I don't just sit behind the desk. I'm out on the floor too. If I see something needs to be done, I'll do it.
So you're willing to pitch in whenever,
Yes.
and that's important too. I think too many nurses who get in our positions do not interact, or they demand that you do things, but they don't do.
They don't do it themselves. Yes.
So I think that's great.
And I have a great manager right now that's the way she works.
That's awesome. And so hopefully the whole team is
I think
trickled down.
It is. People are picking up on that. Yes.
That's great. That's great. So what role do you allow fellow staff members to play in collaborating on decisions? Like if there's a decision for the department, like what education piece you're going to be doing or whatever.
I try and put out, what would you like to see over the next year? When we're having issues with, last year, we had problems with nurses not documenting I's and O's, PCTs or nurses. For some reason, even though we're a renal floor, they were not documenting I's and O's on these patients,
Right.
not even putting zeros in on our dialysis patients.
Oh wow.
So we had a big initiative and put together, okay, how do you think we need to bring this out to everybody? What do we need to do to make sure that people are doing what they're supposed to be doing? And they helped put some of the material and the education together.
How did they feel about that, being involved?
They like that. I try, and when I'm going to not necessarily change something, but when I see that we need to do some education on something, I'll go to the different nurses and say, okay, how do you think we need to present this to the staff? What would be a good way of doing this? Should it just be a one-on-one? Should it be a simple bulletin board? Should it be something that they have to sign off on? What would be the best way to do this?
That's great, because I think if they're involved in the decision, then there's more buy-in, and then they'll be more willing to accommodate the changes versus,
Yes.
you know, arguing or just like
Well,
upset that changes
I still
happen.
have some that do that, but you're always
Right.
gonna have those.
But were those the ones that were involved in helping to change when you
No.
asked, right?
Well, when you ask them, they don't wanna get involved.
Right. And I guess that's always gonna be the case.
That's it, you're right.
Right. And so, okay, well that's good. Do you allow for staff members to meet their full potential on the floor, or do you hold people back, or how do you think you would accomplish that goal?
I think that we encourage them to do what they can and exceed that. There are some of our staff that are new nurses that we have to baby along,
Right.
but I don't feel like I'm somebody who keeps people in the nest. I try and push them out as soon as I can, because if you don't, they're never going to get comfortable with what they're doing, and they're never going to continue learning and growing.
Right, exactly. And I think that's important, that you're right there and they know you're there, but you kind of, like you said, push them out of the nest. And I love the fact that our hospital is very motivated to get people to go back to school, and we have an education program here that they reimburse us, and it's nice to be in that kind of environment where you are encouraged to better yourself and get certifications and different things like that.
And plus, it's not called clinical ladders here. It's called
Nurse Advancement?
Nurse Advancement Program, NAP. Yeah, that's a nice way of encouraging them to continue to get educated, but also reimbursing them for it, giving them money as an incentive.
Not being on the inpatient side, I've forgotten about that part. So.
Yeah, that's a nice piece.
Right, that is good, and that's only implemented for about 3 years now, maybe 3 or 4 years. Has it been a little longer?
I think it's been a little bit longer than that, and they've they've increased stuff that they do in it.
Oh,
they started out with certain levels, and they've added levels to it, and they've added the pay too.
That's nice. It's always nice to get reimbursed for the work that you're doing. So
yes, it is.
That's great. Let's see, a few more questions. Let's see, how do you, as a servant leader, meet the needs of the individuals while continuing to meet the group needs as a whole?
I do a lot of one-on-one education when I see. Big thing right now is vaccines, admission databases, and we've had some issues again with I's and O's. When I'm auditing charts, I will bring those people in and say, okay, you're not doing what you're supposed to, and this is what we've talked about in the past, and this is what your expectations are.
Right.
So I try and bring them in so that our chart audits monthly for the whole group, or our unit, don't drop because of the few, if I see there's a pattern.
Right. And if you continue to see that kind of pattern, do they know what your expectations are?
They know what my expectations are, and then it progresses to counseling by the supervisors.
Very good. Wow. Yeah. And it's kind of steep, but we have to do what we have to do, because as we all know, if we don't document it, then it's not done, even if it was done.
And if you just tell them what your expectations are, but yet you don't follow through, so what? I'm not going to do it because you're not doing anything to make me do it.
Right. And I love in that safety class that we all had to take care, the statement where it says, what you permit, you promote. And that's so true. I mean, and you've noticed that with other leaders and different things in the hospital, even like being tardy kind of thing. If you don't, keep track of it, then you're permitting them to be tardy, and so you're promoting it.
Same thing, yes.
Right. So I think that's great. What if someone suggests things or gives you feedback? How do you handle it when suggestions or feedback when negotiating changes and improvements? Do you want to just do it yourself, or do you want?
It depends. I have one supervisor who comes to me a lot. It seems like every time she works, she's coming to me. The nurses are doing this, and they're not supposed to. Or this nurse is doing this, and they're not supposed to. Well, that needs to come from you. You witnessed it. You were there. You should have done something about it.
Right.
Well, everybody's doing it. I said, what do you mean everybody's doing it? I need proof that this is happening over and over again, so that I know if that truly is an education that needs to be for the whole floor, or is this just someone that you need to talk to.
Right.
I hate when something bad happens, everybody gets the education and not the one person or the two people that need to be educated on.
Exactly. Or if there's something wrong and you say it to everybody and they're all wondering, okay, is it me?
Yes.
What am I doing wrong? And yeah, and that catchphrase when people do complain about something wrong is always, well, everybody said this, or everybody feels this way, and it's usually one or two people,
Yes.
and so that's very hard to.
But generally,
to deal
when people come to me and say that, there's a problem with this.
Mm-hmm.
This has happened several times. Is there something we can do about it? Then, if I can, we work together. But with a staff nurse, most of them they don't have the time to do it on their time, and they value their time off, which I don't blame them. So then I get the suggestions from them, and then we go from there.
Right. That's good. We have I remember in one of my departments we worked in, we had a suggestion box. And so they could anonymously put stuff in if they saw things. And that was good and bad, because I got more suggestions than I thought I would.
And sometimes you don't know.
But then you could get feedback. Yeah.
And you didn't know everything that went around it. Right.
Exactly.
Yeah.
So it's a kind of a catch-22 or something.
But most everybody on the floor, I think, feels comfortable coming to me.
That's great.
With stuff like that.
Well, and it's because of your servant leadership that you've put yourself into them, your life into them, and so they know they can trust you. And so that's great. One last question. Would you describe yourself as a servant leader? And if yes, can you give an example of your ability to display this trait? I know we don't. We don't like to brag on ourselves, but I think you're great.
Thank you. I guess between the first of the year is always busy for the clinicians, because we have nurse residency coming up in February. We have Skills Day coming up in March, April, and May, and I've basically put myself out there to help do whatever for the nurse residents. I teach the class on the IV stuff and do all the coordinating for it, and I do the peritoneal dialysis class. The IV class was not really my decision to make. It was kind of one of those, you do it so well, you need to do it. Okay, that's fine. And then the Skills Day, we're basically doing 8 days, full days, where we're away from the unit, doing skills with everybody in med-surg.
Wow.
So, and then the residency program, we're pulled away, so I don't do my job on the floor because I'm involved in all of this.
Right. Wow.
I guess that's kind of what you're asking for.
Right.
I mean, I volunteer.
Right. And
sometimes too much.
And sometimes it's asked of you, but out of a giving heart, I think, you're like, I can do this. I have the capabilities of doing this, and I've got my stuff organized on my, because you're very organized. So I've got my stuff organized on my floor that I know I have the time to do this, somewhat. Yeah, I know.
Yeah, somewhat.
I know stuff always happens.
Yeah, it is. Like today, I didn't do anything that I had planned on because there was one little thing after another that
right.
I had to do.
That's healthcare, right? And nursing.
That's nursing. That's nursing.
Yeah. So, but well, that concludes our interview. But I just wanted to thank you so much for time out of your really busy, crazy day to come.
I'm out of here by 2, and it's almost.
Hey, we're good.
We're good.
So, so I appreciate it very much, and thank you.
You're welcome.